Hello, my name is Lisa Connor. I'm the Associate Nurse Director for the Doncaster Care Group. We just wanted to say thank you to everyone that completed the recent LIA pulse check. 62% response rate, which is absolutely amazing, so thank you to everyone. We promised that we would give you some feedback. We've read all the comments received and we've put these into 6 themes. And what we're going to do is just mention each of those themes and what we're going to try and do to address them.
Hello, my name is Judith Graham. I'm the Deputy Director for Organisational Learning and Development at RDASH, and I'm also your Listening into Action lead. Thank you very much for all of you that filled in the pulse check. It was our best ever feedback. Not only did over 60% of the organisation provide feedback around rating the different trust areas, but they also specified where we need to make the changes. I'm leading the piece of work where lots of different people in the organisation are talking about values-based recruitment, retention and supervision. We've already started work around changing the way we advertise to attract people with the right values. We've started also to change our interview packs, and the next phase of work, informed by the feedback that you've given within the LIA pulse check, is to work on how we supervise and how we do our PDRs. We're working towards a more values-based supervisory approach so that we can enhance the experience that our staff have in terms of being supervised, also in terms of looking to the future and what their learning needs are, and so that they can define clearer career pathways and goals and be supported to achieve those goals. We know that the best trained workforce who have appropriate supervision give the safest care for our patients, and that's what we all aim to do.
Through the LIA pulse check, a number of staff have raised issues regarding the working environment of the buildings they're working in. I'm sure people can appreciate that some of these issues are not a quick fix. However, I would like to reassure everyone that these issues have been noted and will be used in any discussions regarding our future estate strategy.
Hello, my name is Jane Hillier and I'm talking to you about the electronic patient record and other system-related issues. Some of the feedback that you gave us related to System 1 and other system-related issues. The common themes identified from your feedback related to IT connection issues, agile working and IT equipment, and System 1. You told us about your frustrations and concerns, and we want to work with you to resolve these challenges. We anticipate that some of the IT connection issues will be resolved once we move to the new locality bases, when all community teams will be issued with agile devices. Please ensure that you report any specific incidents to your team manager so that we can monitor and escalate any ongoing issues. An agile app is currently in development which will keep you informed of hot desking locations and how to access buildings safely. Now that System 1 has been rolled out across the entire care group, we want to involve staff in making the best and most effective use of the electronic patient record. Please share any success stories and challenges with your team managers to help us further improve the way we use the system. One frustration that you highlighted was that your System 1 access was removed if you didn't log on for 30 days. We have escalated this and a decision has now been taken to increase this to 60 days.
Hello, my name is Alissa Lancaster. I'm Head of All Age Integrated Services for Doncaster Care Group. I'm going to talk to you today about leadership and visibility of the care group leadership and what we're doing to make us more visible to people that we work with. So as part of our LIA feedback, we became aware that we weren't always visible as we could be, that communication between our staff and the people that work within the care group could have been better. So what we're doing is things like this, about talking to people, putting out a video, putting together leadership boards. So in each care area we have a board with a name and our job titles on so people know who we are. We're also putting a timetable of visits to go out and visit the bases. Now there's a lot of you, a lot of bases, and it will take time to get round, but we are coming if we haven't already been, and we're hoping to meet as many staff as possible and be more visible and communicate things that are going on in the care group, and so you know who we are, where we are, and how to contact us. Thank you.
I would like to share with you some of the work which has taken place over the last 12 months across the Trust looking at staffing. A tool for the review of existing job adverts and to improve future adverts to attract the right staff was developed to ensure we are reflecting the Trust values, which resulted in an increase in the number of views an advert received and ultimately how many people applied. The information collated from exit interviews has led to an improvement in the induction process for our staff, both at corporate and local induction, which has helped to improve the support for new staff. When students have secured a post with a community nursing service, liaison with the university has enabled their management placement to be with the team their new post will be, enabling them to induct and settle into their new team. The trainee nursing associate role are being introduced to provide a better career progression across the nursing profession. The number of mentors and in turn the number of placements we can facilitate has increased, particularly in areas such as forensics, which students may not have previously considered as a career choice. There is an accredited preceptorship course available for new staff to access at level 7, which promotes the development to the academic level which can support future development. As a collective group of actions, this has reduced the turnover rate within the Trust, which in turn has increased the capacity within our services through the reduction of the vacancies we have experienced over recent years, both locally and nationally.
You said we need to see more occupational therapy in mental health services for service users. We did. It has been recognised that there was a need to provide some occupational therapy provision from an inpatient perspective, as in some areas there was none. A senior occupational therapist post for one of the inpatient rehabilitation units is in the process of being recruited to. This will help people to increase their independent living skills and return to live in the community faster, ensuring a safe and effective discharge from hospital. Occupational therapists oversee time-limited interventions provided by support staff, such as goals around using public transport, daily living skills and social activities. This will make sure that the maximum number of people are benefiting from the service provided. By using this resource differently, opportunities have been created for support staff to develop their skills and knowledge. This will make the work being done with service users towards discharge and recovery achievable. Occupational therapists, support staff and peer service users are facilitating group work in the community, using and developing current resources in order for service users to work towards their recovery goals and to educate them about managing their mental health. It provides an opportunity for service users to develop social support with people with similar needs and interests and to maximise independence. By using places such as The Point and Doncaster College as community venues, people using services are given the opportunity to familiarise themselves with third sector organisations as a springboard to resources available to them in their local area.